Hello, my name is Catherine Owen. I'm a midwifery matron for midwifery here at the Great Western Hospital. We know that many people expecting a baby and their families have had lots of questions for our team during the coronavirus pandemic. And whilst we've tried to answer so many as we can, we thought this video might help to update you on our current position. Despite the challenges that COVID-19 brings, babies will continue to be born. As we approach the year anniversary of the first coronavirus cases being diagnosed, we've reflected on the almost 4,000 families we've supported to give birth during the last 12 months. Many of you will be due soon, so what does COVID-19 mean for somebody expecting a baby? We are currently allowing one named birth partner to accompany someone to their 20-week scan, but we are still asking you to attend your 12-week scans alone. This is due to the restrictions on social distancing in some of our smaller ultrasound rooms. We would like to reassure you that everyone is working very hard behind the scenes to ensure that we can soon resolve this issue in the very near future. Those coming to the hospital in labour can be accompanied by one named birthing partner. This person can stay with you from the start of labour and throughout. Please be assured you do not have to be any particular stage of labour before your birth partner can join you. Your birthing partner should bring supplies with them. We all know that some babies take a lot longer than others to arrive, and your partner will not be able to leave the ward to pick up any food or drink. If you have a caesarean section, your partner can stay with you for the entirety, unless a general anaesthetic is needed. They can also stay during visiting hours once you have been transferred to the ward for postnatal care. You will be asked to have a COVID-19 swab test done on arrival to the department. Whilst we cannot enforce this, we do encourage you to have the test so we can look after you in the safest way possible. Those who test positive will be isolated in a side room and cared for by staff in full personal protective equipment. Those who test negative will be cared for in a separate ward area. All birthing partners must wear a surgical mask at all times, and women will be asked to wear one when they are not in active labour. We will provide you with a mask if needed. If you have coronavirus symptoms when you are starting labour, please call the delivery suite ahead so arrangements can be made for you. This is the same for anybody due to give birth at the White Horse Birth Centre. If you or your birthing partner is showing symptoms of coronavirus, they should not accompany you. They must self-isolate in accordance with government legislation. This also applies if you or your birthing partner have already tested positive for coronavirus. Please consider having a backup birth partner should this happen. During your stay in hospital, we will do our utmost to ensure the safety of you and your baby. Whilst we know this is not easy to give birth in the current conditions, our staff are dedicated to ensuring you have the most comfortable and safest experience possible. We will be with you every step of the way. If you have any concerns before your labour, please do not hesitate to get in touch with your midwife. We are always happy to help and can discuss any worries through with you or your family. We want you to feel supported and reassured throughout. I would also like to remind you that our website is the first place we will ever change any updates, so it's always best to check on there first. We also have a detailed FAQ available on the website for any questions I might not have answered during this video. We'd like to send our best wishes to all the families who've had babies born over the last 12 months and to any babies and their families we welcome into the world whilst the pandemic continues. Whilst this certainly isn't a normal way of working for us, our number one priority remains with all our families. Thank you.